Good afternoon, everyone. Thank you very much for this opportunity to present at this conference titled Answering Big Questions with Big Data. I will discuss with you about gender disparities using data to drive changes in Asia-Pacific region today. I have nothing to disclose, but I'm working with these listed organizations in transplantation. I will divide my presentation into 5 parts. In this presentation, I've used a gender gap index, the Global Gender Gap Index 2022 of World Economic Forum, which was reported in previous July, and some part of GGGI 2021, where GGGI 2022 is not available yet. GGGI is the most recent and well-known index in gender gap analysis, which has been presented during the annual World Economic Forum since 2006, using the same methodology. According to the GGGI 2022, only 69% of the overall gender gap has been closed in East Asian and the Pacific region. In the list of top 50 gender equal countries among 146 countries, only 4 East Asian and Pacific countries, New Zealand, Philippines, Australia, and Singapore were included. Korea was listed 99th among 146 global and 14th of 27 East Asian and Pacific countries. And more negative impact on gender equity is expected by the coronavirus pandemic in most Asian countries. Next, I would like to talk about the gender-neutral initiative of WIT, the Women in Transplantation. It was established in 2009 by Professor Catherine Wood, the leading scientist in transplantation immunology and the former president of the Transplantation Society. Since then, the WIT has been growing continuously by the incessant effort of WIT leaders and members under the mission of to advance and inspire women transplant professionals and champion issues of sex and gender in transplantation. Inspired by WIT TTS, we established the WIT Asia in 2019 as an official initiative in the Asian Society of Transplantation. And we held a virtual meeting on gender disparity in access to transplantation in February of 2021 to address pressing issues on gender inequity in transplantation in the Asian Pacific region. 14 speakers from 13 countries presented on gender-related issues in kidney transplantation. Most of our speakers were clinicians working in the field of kidney transplantation and organ donation. Most of presented data were collected from the participants' National Transplantation Database, but some of them were from other representative sources, such as center-level data over the past 3 decades. And our meeting report was published in the Transplantation. Now, I would like to move on to the next topic of gender disparity in kidney transplantation in Asia. Gender inequity in organ transplantation seems to exist in all over the world. Female dominance in living kidney donation observed in many WHO regions except Africa and West Pacific region, and male dominance in receiving LDKT in all WHO regions. Our data showed the proportion of female living donors ranged from 30 to 78%. This proportion of female living kidney donors exceeded male in all countries except for Philippines, Hong Kong, and Pakistan. Many countries, including Bangladesh, India, and Singapore, showed more than 60% of female among living donors. The pattern of the female predominance of living donors was sustained across all eras of Australia, Japan, Malaysia, and Korea. Gender imbalance was more apparent in Bangladesh and Indonesia, where the proportion of female living donors have increased over time. Some of many reasons for the observed disparity in living donation could be attributed to the overrepresentation of aged female and female spousal donors. Yuki from Japan addressed that the female living donation started to increase after 40 years of age. In Korea, the increased number of female spousal kidney donation was correlated with the increase of ABO-incompatible kidney transplantation. The proportion of wives donating to their husband ranged from approximately 64 to 90% in Asian Pacific countries. The Korean national data reported the overpredominance of female spouse donors persisted for the last decade. And the proportion of the spousal donor group, a blue line here, is the largest among living donor group in Korea. One of the biological reasons for this fewer men become kidney living donor is even though men wish to donate their kidneys to women, men may be less likely to be accepted as donors because of a higher prevalence of pre-existing conditions such as diabetes and hypertension. In Korea, the prevalence of NCDs, such as diabetes, hypertension, and obesity, have always been higher in men than women for previous 10 years. Another data collected from 255 global resources presented here also showed consistently higher prevalence of diabetes in men than women in all age groups. And men always have higher mortality than women in most countries, regardless of WHO region. Therefore, men are less likely to be accepted as donors because of the higher prevalence of pre-existing comorbidities. However, Asian participants of 2021 webinar agreed that social factors of attitudinal, financial, and power imbalance seem to be more important contributing key factors for gender inequity in kidney donation in Asia. Our second part of data was related to proportion of the KT recipients. Across all participating countries, the proportion of female recipients of LDKT varied from 18% in Bangladesh to approximately 40% in Australia, Hong Kong, and Korea, and 52% in Myanmar. This data stands for fewer women received both disease and living kidney transplantation than men, even though women donate kidney more than men. When we review the temporal changes, the female proportion in LDKT recipients was increased steadily in Hong Kong, while in Australia, this proportion has decreased over the last 2 decades. A similar finding of lower proportion of female KT recipients than male was also observed in DDKT. As Piccoli described, to understand the gender disparity in KT recipients, sex differences needs to be evaluated in each stage of CKD care. The figure on your left showed women are less likely to be listed on waiting list except for Singapore. As you can see in the figure on your right, proportion of women on dialysis were below 50% in most of Asian countries except Bangladesh. Higher prevalence of treated ESRD in men than women were seen in most of countries. Korea also has the same pattern of the ratio of men and women of 57% versus 43% in patients on dialysis. In the contrary, the female dominant sex ratio is observed in adult CKD in US and most of other countries. Therefore, despite more women having CKD than men, the proportion of female on dialysis dropped to 42 to 46% and further decreased to 40% in the waiting list and further dropped to 37 to 39% in KT. This pattern was observed in Korea when we draw a diagram using our registered data. So far, it is evident that fewer women have access to KT than men because less proportion of women are on the waiting list and on dialysis than men. One biological reason for this gender gap in kidney recipient is less women needs KT because women have a slower rate of CKD progression than men. And another reason is women have a higher instance of medical conditions which prohibit receiving KT, such as hypersensitization, old age, and frailty. The third set of our presentation on gender disparity is related to the gender disparity in career development in nephrology, as Jermaine Wong presented. Australian data showed that nephrology field had recruited many female trainees. However, only a few female trainees have chance to become specialists and professors. Since I have already explained biological causes, I would like to elaborate on it to socio-economic factors and database in the next few minutes. We asked participants of 2021 webinar to choose one or two most important factors for gender inequity among factors shown in this panel. Except for hypersensitization in women, the consensus was that social factors are the key contributors for gender inequity in Asia. The total gender gap index has been presented for sub-indexes. These are economic participation and opportunity, educational attainment, health and survival, and political empowerment. Since educational attainment and health and survival gaps has been almost closed, current gender gap is caused mainly by economical attainment gap and the gap related to political empowerment of women. These two economic and political empowerment gaps are significantly unclosed, especially in most Asian countries, regardless of their national income. For economic gap, one of a series of Netflix documentary titled Why Women Pay Less explained that the cause of the economic gender gap have been changed over time. In early 1950s, main causes of the gender pay gap was a social attitude toward women, such as defining the female jobs and the lower education rate in women, etc. This situation changed within a decade, and raising children became the most important cause now. And within another decade, political empowerment gap became the most important one in developed high-income countries. Therefore, only few women can prove conclusively that a woman could become a great invincible leader and much deserve respect from the society for her contribution in these most competitive male-dominant fields of medicine. It is obvious that gender gap in political empowerment exists in the science and academic fields as represented in these slides. Moreover, lowest proportion in female for leadership position is noted in the Asia-Pacific region as black bars represent. This phenomenon could be influenced by the lowest glass ceiling index of Korea. In our WIT webinar in 2021, we confirmed that gender inequity existed in the kidney transplantation, and this inequity involves not only biological factors, but also many societal factors for women, such as social attitude, finance, power imbalance, and social status. It was very difficult to find solutions since these causative factors are linked, intertwined each other. To understand this highly complicated situation, we construct a web-based database platform, the Extract with KT. This Extract with KT database was constructed using the Extract, the Asian Transplantation Registry platform based on Curie, the Korean Transplantation Database Foundation. Asia is a rapidly changing region which can affect organ transplantation activities. However, there has been no international coordinating transplantation registries in many countries. Extract started from this motivation. The Extract consisted of 3 different database platforms: Extract N National, Extract H Hospital, and Extract Harmony, a platform linked database analysis for pre-existing national registries. It also provides platforms on demand. To start, data from 2015 to 2019 from 6 Asian Pacific countries were collected. This time-controlled data provided information on serial changes in the proportion of female in KT practice in each country and differences between countries. This year, 15 countries will participate to this multinational study using web-based data platform providing on-site visualization on gender disparity in kidney transplantation. I would like to take this opportunity to invite you to join us to seek together solutions for equal rights, equal contribution in organ transplantation. I'd like to finish my presentation by showing you this very famous painting of Korea titled Lovers Under the Moon. In the middle of night, only when the crescent moon is dimly shining down, one young man with a lamp is heading around the corner with one young lady with a long hood. We cannot know what kind of relationship they have, but they seem to be in a clandestine relation, meeting each other in a secluded place, hiding from other people. So the painter wrote on the subject that in the dark night, with only a thin moonlight, only those two know each other's heart. Do they really know each other's heart? It seems not, because the genius painter expressed this unspoken feeling by drawing the little tip of the lady's shoes pointing into the other direction. Even the hearts of man and woman in deep love can be like this. It will be impossible to achieve gender equity, especially in Asia, if we cannot or do not communicate openly about gender-related issues with evidences. I will end my talk by appreciating all the co-workers, particularly Professor Kentida Twin, Young-Hoon Kim, Mian Han, and the leaders of Women in Transplantation, represented by Professor Rosmanon. And I would like to thank again to the organizers for giving me this opportunity today. Thank you.